Hi, everybody. This is the beginning of the CSMT Trust Benefit Counselor Training Call, and we thank you for coming on board to help with all the different accounts that are part of this group. Mike?
Hi, everybody, again. So happy Friday. We're recording this on Friday. I'm not sure the day you're going to listen to it, but the California Small Manufacturers Trust open enrollment period is here again. It is that time of year. It starts somewhere a month and a half, 2 months before June 1, and it runs continuous at high volume until 5/31, or the last day in May. And then all of the effective dates, as they have been in the past years, are June 1. So each of you that are listening to this phone call will have certainly been invited to participate in one of the groups that we are enrolling for Gallagher. And it is likely to be a core enrollment service that we're providing to the groups. There may be a case here and there where it's colonial only, but most of the time it's going to be core services. So the agenda is going to be that our broker, Jonathan Monroe, is going to be next. I'm going to be through in about 15 seconds, and he's going to walk you through all of the core plans that are being offered. And then I will do a quick review of the underwriting offer we have on the Colonial Life plans that are in place, and then there'll be a wrap. So as in the past, thank you for your good service. Thank you for taking care of the employees. And Jonathan, I'm going to hand it over to you.
Great, thanks, Mike. And just to reiterate what Mike said, thank you all again for your continued support and wonderful work with the trust. I know most of you have had familiarity with this product in the past, and I know this is the sort of thing you guys do day in, day out, so I'm going to try and be very concise in reviewing it. Of course, any questions that arise after this presentation, you feel free to reach out, of course, to Andrea or to myself directly with any clarifying questions. So first, just to begin and jump right in, we have the kind of a major division in our products that are offered through our special trust program, and then we have Kaiser, which stands separate. So we're looking here at a Kaiser tab. Now, the thing about Kaiser is there could be some variations, whether it's a large group or a small group. So what we have here are actually plans that are small group Kaiser plans that a company may have just directly with Kaiser. They may be offering one of these or all of these, or if they're a large group Kaiser, the plans might not look like anything like this at all. But again, with your experience, I know you can just look at this briefly and see if you're not familiar already with the Kaiser small group renewal options for this year look like. So on here you've got your deductibles, out-of-pocket maximums, doctor copays, and then just kind of the essentials down the line. The big thing about Kaiser to remember is these will be age-banded rates on the small group side, whereas the trust, regardless of how big the employer is, are all composite rates. So the rates are going to vary on the Kaiser for most of the businesses that are offering Kaiser alongside of the trust. Kaiser enrollment will be a little different. For anybody newly enrolling in Kaiser, they will need to fill out a physical application for Kaiser. If they are already enrolled in Kaiser and their dependents are already enrolled, we'll have a change form, an election form, where they can just indicate which plan they want to elect. But otherwise, for any new enrollees or new dependents coming on, they will have to have a physical application, which will be in their enrollment packet on site when you're already sitting down with them. Andrea, we can go ahead and go over to the next tab.
Alrighty, and I'm going to interject here our first password. It is going to be April 21st.
Okay, so again, just as a recap for you, for most of you and for anybody newly enrolling, the trust program is pretty unique in that HealthNet is our medical carrier, but we've got several networks that we offer. You will see different variations of this. So while there's this total product offering that we're going to look at here, each group decides which plans and networks they want to offer. Some of them may want to offer them all, which typically does not happen. And so you'll see some that only offer one medical plan. Some might offer, up to 4 different medical plans. So what we're looking at now is our 2 full network HMO plans. These plans will be more expensive than the other plans we look at. And the major reason why is because it is Health Net's full HMO network. Most notably, this network contains Cedars-Sinai and UCLA in-network. The plan designs, you'll see when we get to the next tab, mirror exactly two of the plans we have in the Excel Care. That's the next step down, limited network with Health Net. Again, the only difference is that this is a larger network of providers. So very briefly, the way this plan works, the first one listed has a $2,000 out-of-pocket maximum for the individual. Most of these Health Net plans have a 3-tier maximum, so $2,000 for the individual. If it's two-party, employee spouse or employee child, it's a $4,000, and then if they have 3 or more family members enrolled, it's a total $6,000 out-of-pocket maximum. Doctor visits on the first plan are $20. On the second plan, it's $30. And then inpatient hospital on the first plan is a $500 copay per day, up to 4-day maximum. At that point, they've reached their $2,000 out-of-pocket maximum. And then on the second full network plan offered, it's a 30% coinsurance. However, keep in mind, again, it's capped at $2,000. So even if it's a $10,000 surgery, they would be responsible for 30%, which would ordinarily be $3,000, except they're capped at $2,000 on this plan. Outpatient surgery on the first higher option plan is a $500 copay. On the lower plan, it's a 30% copay. And then complex x-rays, MRIs, et cetera, is a $100 copay per test. And then ambulance is $100 on both. The urgent cares are the same as the doctors, and then the ERs are both $100 copay. Prescription drugs are the same, $10 level 1, $35 level 2, $50 level 3, and there is a $150 brand deductible on these plans and the other HMO plans we're going to look at. Okay, Andrew, next tab. Yep.
Jonathan, what were the two additional, the full network? You said Cedars-Sinai, and what was the other organization that was on the full network?
UCLA. Those are the two biggest.
UCLA.
Most people.
Okay.
Yeah, if they're paying to be on here, it's because they want access to those two providers.
Got it. Okay. And let me.
Okay, so now we're looking at our Excel Care Limited network. Again, it's very comparable to the network we were just looking at, with the most notable exception of those two providers, UCLA and Cedars. Two of these plans here are exactly the same in their benefit structure as the ones we just looked at, namely that the first two plans listed. So those are the ones, $2,000 out-of-pocket max. One is a $20 doctor visit, the other $30, and then the $500 copay per day, up to 4 days on the first plan, 30% on the second. And then the third and fourth plans, the fourth one that actually Andrea was just highlighting right there, it's almost identical to that first $20 plan. The only difference is it's a little richer because on the hospital, instead of a $500 per day hospital, it's a flat $500 copay. So it's going to be a little more expensive. All of the other benefits are the same as that first HMO plan we looked at. And then the lowest cost plan in this Excel Care Limited network is the third plan listed. It says HMO 9IN. You'll notice it's different than all the other plans we've looked at in that the out-of-pocket maximum is $4,500 for the individual. And also, whereas I mentioned before, these other plans have a 3-tier maximum, this one is only 2-tier, meaning $4,500 for an individual, and then if you have employee plus 1 or employee plus 10, it's the same. The family max is $9,000 out-of-pocket maximum. Doctor visits are $40 on this plan, and co-insurance for hospital, inpatient or outpatient, is 40%. Urgent care is a $40 copay as well, and then the ambulance, emergency room, and prescription are exactly the same as the other HMO plans we reviewed. So again, this is the lowest cost plan. As health insurance costs continue to increase, you'll probably see more and more employees or employers offering this plan or electing this low-cost plan.
Okay.
Okay, next tab. So then we're at our PPO options with Health Net. So there are technically 2 traditional PPOs and 1 HSA. Again, it will be unusual that any group would offer all of these. You would see maybe a PPO and an HSA offered at the most, but there might be occasions where you will see all of these. So the first one is the high option plan listed. It has a $500 individual deductible, $1,000 two parties, and $1,500 for three or more. Out-of-pocket maximum in-network is $3,000 for the individual, all the way up to $9,000 for the family. Doctor visits are $20, and then the co-insurance on this plan is an 80-20, so the insurance company is going to cover 80%, and the subscriber is responsible for 20% up until their out-of-pocket maximum. Now, the deductible on this plan goes towards the out-of-pocket maximum. The prescription is a little different than the HMO plans. It's $15 copay for level 1, $30 for level 2, $50 for level 3, and the brand deductible is $100 on the PPO plans, whereas on the other HMO plans it's $150. The second PPO plan listed will have is almost exactly the same as the one we just looked at, except the deductible is twice as much, so it's $1,000 for the individual. And then, but the out-of-pocket maximum is the same. And then the doctor visits are $30 instead of $20. But other than that, everything is identically the same, except for the urgent care doctor visits. And then thirdly, we have the HSA plan. The HSA plan, there is a plan change here that was due to ACA compliance. So the deductible is $2,600 for the individual. It used to only be $1,500, but now also the deductible is an embedded deductible, meaning each member of the family has a separate deductible, whereas before it was an aggregate deductible, meaning if an employee had a dependent on enrolled, they had to meet the entire family deductible before the insurance kicked in. But the thing to point out, it's a really nice HSA plan because the out-of-pocket maximum is only $3,000 for the individual, which is only an extra $400 above the deductible. So once they reach the deductible, they only have about another $400 out of pocket, and then everything's covered at 100%. The co-insurance after the deductible is met is 20% across the board for all services. Now, one thing I want to note on the PPOs, you may see in certain circumstances, there are separate out-of-state PPO plans, and a couple of them have slightly different rates. Those will be in the system, and we'll have those indicated. Andrew, we'll make sure if you don't have those already, you may, I'm not sure. But there are a few occasions where you might encounter, you're enrolling a group and they have out-of-state employees. Those out-of-state employees would have separate technical plan names, even though the benefit designs are exactly the same as these three plans here. It's just the rates might be slightly different.
And those will be provided as needed on the groups that have out-of-state employees then?
Yes.
Okay. Are we ready for the next one? Okay.
So here is another HMO option. It's a further reduced network. For those of you not familiar with HealthNet's Saloon network, the focus is in the greater Los Angeles area, a bit of Riverside County also for our groups. It is more of a clinic style access to health care, but it has some cost advantages to it. The participation in these plans is very low. Some of our employers do choose to technically offer it just because they're the lowest cost plans and it can help them with their affordability calculations for ACA compliance. You may see them, but basically we've got a high option plan on the left and then a lower option on the right. The first plan has a $1,500 out-of-pocket maximum, which is really low, $15 doctor visit, and then 20% co-insurance. And the rates are relatively low for the benefit, but again, the amount of providers is much fewer, are much fewer than the networks that we looked at previously. The second Salute plan has a $4,500 out-of-pocket maximum for the individual, $40 doctor visit, and then 40% co-insurance. So again, you may see these offered. There may be some enrollment, but these are probably the least popular HMO plans if they are offered at all.
Now, can they use, are these the plans, can they use these in Mexico, or are they just,
yeah, that's right. So there is there's, on the detailed benefit summaries, you'll see these plans have access to the SIMSA network across the border. and they get an elevated benefit schedule over there. So their copays are practically nothing if they go to a CIMSA contracted provider in Baja California.
Okay.
Okay.
All right. Next, I'm going to embed our next password. The next password is happy.
Okay. So we have 2 dental HMO plans that can be offered. Again, you might see groups offering both of these plans, maybe only one of these plans or neither of these plans. These are the exact same plans that have been offered. MetLife was the carrier and will remain the carrier. However, we were able to get a rate decrease. So that's something we'll be mentioning in our general open enrollment meetings. But these rates went down, but it's the same plans as before. We have the highlights here of the fee schedules for some of the most common types of procedures, but there will be detailed benefit summaries with the benefit schedule, the detailed benefit schedule.
Okay.
Same network between these 2 plans. The first one has lower copays out of pocket than the second one. And that's it.
Okay. That's it. Alrighty.
Next tab. Okay, this is one of the few areas where there are changes this year. So currently in our trust program, Principal is the PPO provider. They are being replaced by MetLife PPO. So again, MetLife is already in place on the HMO. They will be in place on the PPO. The benefit schedules are largely the same, although which we'll review, and MetLife decreased the rates as well. So something important to know, even though there's a change in carriers, employees will automatically be mapped over to MetLife. So even though the carrier is changing, if they're already enrolled in the dental PPO plan, they do not need to fill out a new application. They will automatically be mapped over. If they want to make a change, they can just use the election form to indicate which plan they want to be on. But again, let's say they're on the Principal High PPO and they don't want to make a change from that, they'll automatically be mapped over to the MetLife High PPO. However, if they're not enrolled in the PPO dental insurance and want to come on, then they will want to fill out an application. And so, again, Kaiser is separate. They will have its own application. Go ahead.
I was going to say, so for example, if they had MetLife DHMO and they really liked MetLife, but they wanted PPO, and they decided they wanted the new MetLife PPO plans, they have to fill out a MetLife change form?
Yeah, they'll be, well, we'll have our own trust change forms they can use. Really, if they switch from PPO to HMO, they'll have to fill out a new application because they need to input their primary dentist they want to elect. But otherwise, it's really only if they're not enrolled in the PPO and then or not enrolled in the dental and then are coming on for the first time or adding independent. They need to fill out a new application. So we will have universal applications for the trust products, for the medical and the dental and the vision, instead of separate. But again, if Kaiser is offered, it will be a separate Kaiser application.
Okay,
Jonathan,
so
you just talked about a universal. Go ahead, Andrea, you were on the same thing.
Yeah, so instead of doing a separate HealthNet, separate MetLife, there's just going to be one. There's just going to be one universal app for both.
That's correct.
Okay, follow-up question. So my earlier understanding was that this was going to be all electronic except for the Kaiser app. So I just want to make sure I'm tracking. So
no, because do you remember our conversation with Jeff, Mike? Remember he said that was what we were trying to get the approval for, and he said they needed a wet signature for all new enrollees?
You know what? I thought it was Kaiser only, so my bad.
No, because Kaiser's not with the trust, so MVI doesn't care about Kaiser because they have nothing to do with Kaiser. Yeah.
Okay.
So again, for new enrollees, MVI is asking for that universal app to be filled out, but only for new enrollees. Anybody changing from within, the changes can be tracked. We'll have like a physical election form for them to sign, but otherwise, all of those changes can be processed electronically through the system.
Okay.
Right, nice.
Are we going to go through the form today?
No, because it's still being finalized. So
Okay,
we don't have, it's been, they're adding MetLife to it.
got it. So Andrew, we're going to need to do a special on that application to make sure that every box is understood so we don't leave anything out and get ourselves in hot water as soon as it's ready, okay?
Okay. Okay, so are we done with the PPO
Yep.
dental?
Well, really quickly, the MetLife high PPO. So very briefly, $50 deductible for the individual, $3,000 calendar year max, 100% preventive services in network, and then 80% basic services in network, and 50% covered in network for major services, and then orthodontia up to $1,500. The out-of-network on the high option is a UCR. So we always just like to encourage them, again, remind them not to go out of network if possible, and it's an 80th percentile UCR. The low option plan is a $1,500 out-of-pocket maximum, and then everything else is the same in network except there's no orthodontia. And then the out-of-network is based on a maximum allowed coverage.
Okay.
Okay, and that's it. And then vision, there's two vision plans. These are the same as were offered before. There's no change in cost to them. And the benefit summaries benefits are pretty straightforward. $5 copay on the high plan, $10 exam copay on the low plan. Contact lenses are covered at 100% on both, although there is a materials copay on both. Frames are covered up to $150 on the high option and $130 on the low. And the big thing is the frames frequency on the high option is every 12 months. They get a frames allowance. On the low option, it's only every 24 months. So the high option has some significant benefits. If they offer both, we always encourage them to consider the high option just because of the elevated benefits.
Okay.
Okay. And then we have some special products with Unum. So we've got a basic life policy. If they offer it, you'll know at which level, so they can offer it either on a flat 10,000, 25,000, or 50,000. The age reduction is at 65. The first one, so then it goes down to 65% of the eligible original amount, and then at 70 it goes down to half of whatever it is. But that's it. So you'll know whether it's a flat 10, 25, or 50 if they're offering it. And that's all.
And this is usually a product that the employer is providing, and
that's
the employer
right. This is employer sponsored,
yeah.
So you don't need to worry about the cost or the rates or anything like that. But then the next one is the voluntary life, which if it's offered, you'll see. And just briefly, you'll have the rates there per $1,000. But basically, it has, for anybody who's enrolling for the first time, this is the first time, I mean, that it's been offered to them, they can apply for 5 times their salary with up to a guaranteed issue of $200,000. If they've already had the chance to enroll before and didn't take that maximum, then they can apply and increase it by $10,000 with a guaranteed issue until they get a total coverage of up to $200,000. They can also apply for their spouse up to a guaranteed issue amount of $50,000 and $10,000 for children.
Okay, so if they didn't take advantage last year, they don't get up to the guaranteed issue amount. They only get up to.
They can apply for more, but the only thing, that's right, they're only going to be able to increase it on the guaranteed issue by $10,000. So if they only elected $50,000 last year, they could add another 10 to get up to $60,000. They could apply for more, but the remainder would be underwritten.
Okay. And then.
Okay. And then they may all offer also voluntary long-term disability. And there's 2 options. With you don't need to worry about it. Basically, the company has to decide which one they're going to offer. One is a 5-year duration LTD plan, and the other one is an so Social Security normal retirement age option. So depending on which one they offer, you'll have the corresponding rates included. But basically, 60% coverage amount up to $6,000 per month. It's a 180-day elimination period. And it's a very good benefit. And Mike, I don't know, I'm sure you, or I don't know if you're going to address this elsewhere, but basically the compensation built into this for these products as well.
I was going to wait for you to get done. Yeah.
Perfect. Go ahead.
So everybody, one of the things that we worked out this year was an arrangement with Unum so that we've got compensation that's going to come to you. I need to just finalize everything, so I'm not going to throw numbers out, but it's definitely an incentive to promote this product and try to push it with the employees. We're talking about something in the neighborhood of a 5% commission on the Unum products that are offered here. So that'll be paid as we submit business, and they pay their bill, and we get commissions just like we do at Colonial. Similar thing goes on at Unum in terms of how we pay it. So please know that, and I wouldn't email me or anything like that with questions because I'm going to be broadcasting out details on that. So right now, I just haven't put the details together. Back to you, John.
Great, thank you, Mike. And again, just that's on both this Unum LTD as well as the Unum Voluntary Life. So both of those products have that built in as well. So it is something that we are trying to increase participation on. So if it's offered there on those voluntary products, we definitely want to promote them to the employees.
Okay.
And then that's really it for the core trust offering. As you know, there will be occasions where sometimes there might be a benefit outside of the trust and the Kaiser that we've examined today that might be in place. And we'll make sure to communicate that in advance for those kind of ad hoc situations. But by and large, most of the benefit offerings that you encounter will be something from what we've reviewed today.
And for all the groups, when the benefit counselors arrive at the location, the employees are going to have packets, or they're going to be there with any forms that are needed, whether they're trust plans, or whether, like you said, it's the odd occasion where they are enrolling a plan outside the trust. You'll have whatever forms are needed at the location, correct?
That's correct. So every group that you go and sit down in front of, we will have already been in front of them, giving them all the enrollment material, time for them to examine and review the information in advance of the one-on-one meetings, and they should be prepared to sit down with you with their decision largely made already in terms of what they're going to enroll.
Perfect. Mike, are you ready to talk about our Colonial offerings?
Indeed. So you're going to pop it up there? Okay, so if you'll just raise it up just a little bit. All right, so we're going to go through this kind of quickly, because if there's one thing we all know, it's our Colonial Life plans. So same plans as last year, same underwriting offer as last year. Okay, I'm done. No, I'm kidding. No, I'm not going to stop there. So they're all group plans. They're all group plans. Let's just hit them real quick. Group accident, and this is both on and off the job coverage. We have guaranteed issue, as we always do, and as always, pre-ex applies in these cases as well. And they do have, note that they have the sickness, hospital, confinement rider, and wellness benefits. So that's noted on group accident. Next one, group disability.
No.
Really?
Wellness benefits were not, they weren't chosen.
Oh, they weren't? I thought we did. See, this is why you have to be on this call with me, to keep me straight.
Yeah.
Okay.
Yeah, none of the riders were chosen, just on and off the job, just the plan 1 and plan 3.
Okay.
I
Sounds
guess
good.
Cost down, because.
Group disability.
All right.
GI, up to $4,000, 60% or $4,000 a month. Of course, they can apply for more, as we know. So the 4,000 is guaranteed issue. The amounts that they apply for above 4,000 are going to be underwritten. It is off the job only. If you needed to, if you were going to sit down and pull a rate table or something like that for quick reference notes, it's AA. There's no 24-month benefit period, just 6 and 12. And for the elimination periods, we have the 7, 7, 14, 14, and 30, 30 elimination periods. And again, pre-X does apply to disability like it always does in every case with Colonial. And the next one is group critical care.
Wait a minute. I want to interject something here. The databases with the group products are always set at 60%. Keep in mind, any employees that you're enrolling in California, you need to cap it at 40%. So do not go up to the 60% in California.
Yeah. Group critical care. So this one is, I believe, Plan 2. It has cancer coverage with us. So it is a guaranteed issue. We have a $20,000 guaranteed issue amount, which is really nice. They're not going to find that anyplace else. Just keep in mind, family and spouse is going to be half of the employee's benefit. Again, pre-existing conditions apply. Group medical bridge. We have Plan 1 and Plan 2, so let's hit the differences here. If someone is enrolling in an HSA compliant medical plan, the question needs to be asked if they're going to open a health savings account. If they are not, they can have Plan 1 or Plan 2, it doesn't matter. But if they're going to open a health savings account, they can only have Plan 1 under Group Medical Bridge because it's the only plan that's HSA compliant. On the other hand, you know, if somebody is in any other plan that's not HSA, they can have either Plan 1 or Plan 2. I'm just repeating what you already know, but I just want to make sure that, you know, you guys don't forget. It is a single benefit of $1,000, so we didn't do any choices. We wanted to do it this way, so decision making could go a little bit faster. And there's a 12-12 pre-X, it always applies. And then with whole life, we have up to $75,000 guaranteed issue. It's whatever $18 a week will buy at that person's age. So up to a maximum of $75,000. And we have standalone spouse riders, you know, like we always do. We want to give out the discount card and make sure we do that with the employees, give out the coffee, you know, knowledge of financial education. Be sure and give that out to the employees. And I believe that's going to be everything we need to do here. On an individual basis, Jonathan, are we going to be offering benefit statements to anybody, or are we going to keep this nice and clean? Because it's done online through Employee Navigator.
Yeah, I mean, I think it'll be, I don't think so. I don't think we're going to, no.
Yeah, okay, good.
Yeah, keep it nice and simple.
And just a couple of other points, it wasn't written here, but for the group medical bridge, the Plan 2 hospital confinement, it's the option 1 for the outpatient surgery, where it's $500 for Tier 1 surgeries and $1,000 for Tier 2 surgeries. So just wanted to point that out, and I think that was it. Try to remember. I thought there was one more thing, but the group critical care with cancer, this plan is also the HSA compliant version, so anybody who they can use that with an HSA plan as well. So that was a couple of things I wanted to add to what Mike said. And then, like Mike just briefly mentioned, I will be sending everybody, you know, it's a PowerPoint. Most of you, I'm sure, have used Employee Navigator. It is a user-friendly system, but all of the trust cases are going to be enrolled through Employee Navigator with the plug-in connection to Harmony established. So you will be doing all the choices in Employee Navigator. And you will like it when we get to the age-banded rates, because in Employee Navigator, the background calculations that are in Employee Navigator, they calculate all the ages and make one nice amount on the election form instead of showing first enrolling the employee first and next enrolling the spouse, and then child 1, child 2, child 3. So you will see some differences like that when we get to, if you have any of the groups that have Kaiser that you assist us on. But please be sure to go through any information that you find on Employee Navigator, and I will be sending you Employee Navigator instructions as well. And you will be receiving your login information for each case. For each case, Employee Navigator requires a different user name. So your first time that you enroll on one of the trust cases, your username will be your first initial and your last name. And if you do enroll on subsequent trust cases, then I would keep track, like you keep track of all your passwords for your different credit cards, whatever you have passwords for your computer. Please keep track of your usernames and which cases it is for with Employee Navigator. You can set up the same password, you can use the same email, but your username is what has to be different every time. So, once your first initial and last name is used, the next case you're on, it'll be your first initial, last name, and the number 1, and the next one will be first initial, last name, number 3, number 2, and on up. So it'll just have a digit after your first name and last name to differentiate between the account that you're working on through Employee Navigator. But you'll see those details and instructions in the material that I'll send you on Employee Navigator as well. Let's see, Jonathan, Mike, do you guys have anything else that you want to say?
I don't, but other than, be on the lookout for a follow-up video where we will do the universal enrollment form, and we'll go through it to make sure that everybody understands exactly how to fill it out for the trust.
Great. And that's it for my end as well.
Well, thank you, Jonathan. Thank you, Mike, for being on this training call, and I will give the final password Friday. So you have April 21st, happy, and Friday. And please send me all those passwords so I know that you listened to the training. And thank you, everybody, for helping on the trust cases.
Thank you.